We move from that story, and relatives of a 50-year-old woman from Antwa in the Ashanti region who needs blood at the Menchia Government Hospital say they risk losing her if she does not get access to the blood. The woman on referral from a private health facility has been in need of blood since Wednesday, but relatives say results from blood samples taken to the laboratory have not returned. The blood banks also remain closed due to the ongoing strike by the laboratory scientists. The labs at the Menchia Government Hospital remain locked as stranded patients struggle for their services. A sister of the sick woman in dire need of blood, Yanyako, says the family is in a fix as they await divine intervention. She spoke to Ohiming Teria of our health desk, who has been monitoring the impact of the strike.
Nansana yedine ba na washo tumojo lab for na betwen na omde ko hie man kan nra na omde bibia beba na dia besi ne so afa nra ye ba ya se o ya mukosrak o da hosa na so ye ba ya sa tese se hu ba bia e benya moja ni bia e di besi ne so nti esi ye tena hosa ma menuen awu ansa na ma sa ba start e twuma ye ba ha se no kura ni nyame anim no sika ya tua de esi no yan no ano so ama enema toba ha ama ye ya ka chen de sie to no moja na se onya moja ni bidia ene yen kan kira ni yin no kofi nko no kwa so sa ya se ntimi ka so kofi no kona sa mo aye ne a na ye ne den enti se mo bi wo ha ya sere se panyin na ani a omumu aye na omuma ye bi.
Ohiming Teria himself joins us. Ohiming, first of all, for the sake of those who may not understand this interaction because it was in Twi, what is Yanyako saying?
According to Madam Yanyako, she brought her sister, a 50-year-old woman, who was referred from a private facility at a dream in the Kwabre East municipality to the facility, that is the Menchia Government Hospital. But for 3 days now, first, about on the third day, that is Wednesday, the medical laboratory scientists came around, they pick blood samples with the hope that they will go and test so they can understand the compatibility of a blood that was supposed to be put on her. So they went, and then yesterday, they went back to the facility with the hope that the blood, that the samples that they took, the results would have been ready. But they were told the medical laboratory scientists were on strike. And as it stands now, she says her sister is in dire need of blood. And if they don't get the blood, the possibility of the family losing her is very high. And he appealed to the members, the striking members, especially at that point in time was when I had a conversation with the regional chairman of the Ghana Association of Medical Laboratory Scientists. So he appealed to him if there's something that can be done. So that is her narration.
Now, Ohiming, on this conversation you just referred to with the regional chairman of the Ghana Association of Medical Laboratory Scientists, what did you gather?
From Mr. Eric Kofi Edu, he thinks that there's nothing that can be done to reverse the situation once the medical laboratory scientists are already on strike. But they can't come back to say, okay, for the sake of this woman, 50-year-old woman, we are going to support her. And he suggested that the only option available now is to transfer the woman from Menchia Government Hospital, preferably to a private facility in order to save her life. We can listen to him.
I feel bad to hear her story, but I think that me feeling bad for her should also prompt the government also to resolve this matter once and for all. In fact, it is not our wish, it is not our liking that issues should get this way. If I had my own will, maybe I would have helped her out, but unfortunately the blood bank is locked. The medical soup and the administrator have locked up the place because they feel that once the strike is also on, there's no reason for lab scientists to be around. And so there's nobody around and the offices are all locked. And so in her situation, I wish I could help, but unfortunately, nothing can really happen now. Taking her out of the hospital is an option, but unfortunately, where exactly is she taking her to? Maybe to a private facility who may have the blood to give, but to a public facility, I doubt, because the same lab scientists should be around to help them. Unfortunately, the lab scientists are not there. So maybe the only option now is for her to take her to a private hospital.
Right, Ohiming, so tell us, what else are we gathering from the various hospitals you've visited?
It's been the same precarious situation since yesterday, when the members of the Medical Laboratory Scientists Association declared nationwide strike. A while ago, when I spoke to Mr. Edu, he gave me a clear picture of how the members have comported themselves and then responded positively to the call for them to go on strike. He was happy that as an association, they are on course. But I must say the situation has taken a toll on patients. I spoke to several patients, and the indication is that they are not happy. They are really feeling the brunt of this strike action by the Medical Laboratory Scientists Association.
Ohiming Teria, thank you very much for joining us with those updates from the Ashanti region.